And then just to preface, don't ever use a vaginal lubricant inside your... There are a variety of different types of lube out there. The most common are going to be your water-based, your petroleum-based, and then your silicone-based. And the problem with what we have out on the market is that most of it shouldn't go into the vaginal biome. Most women don't know that we should be looking at osmolality, and this is how the fluid flows in and out of your vaginal wall, your epithelial cell layer of your vagina. This is your protective barrier to STIs, bacteria, fungus. And if you start introducing ingredients that are not iso-osmolar, they're either hypo or hyperosmolar, then what happens is slowly over time, your epithelial cell layer, your vaginal wall begins to dry out and it literally falls out. So you've just lost your barrier of protection. Don't ever use your biome does not need that. It is self-cleaning. The other case in which you can affect it, obviously, is one of the biggest problems. Coconut oil. This is a big one. Everybody's like, oh, I'm using natural. It's great. It's wonderful. And yes, again, very much like silicone is going to be androgynous. It's the coconut lube that people are using, this coconut oil. They're seeing, one, it's messy and nasty. And then two, we're seeing that over time it begins to breed back bad bacteria. There's only two I know of that are truly iso-osmolar in the entire world.
Hey everybody, quick break on our episode to talk to you about our sponsor, My Libido Doc. One of the things that we truly believe is that great sex is available to everyone, but we just have to learn how. So head over to our site to get your free copy of our ebook, 5 Steps to Mind-Blowing Orgasms and Romance. Get the quick and easy tips to turn your sex life around, rev up your engines, and fall in deeper love and passion with yourself and your partner. So if you just go to mysexdoc.com, you will find that ebook there for download. Now back to our show. Hi, Libido Lounge listeners. Welcome back to another episode. I'm Dr. Diane, your board-certified sexologist and sexpert, and I have a juicy show in store for you today. So one of the things that I often find that is so critical to health, and when we're talking about sexual health on the show, is what lubes we're using and what types of products we're actually putting on all of our beautiful bits, our genitals, right? And so in order to talk about this, I am bringing on an expert today in this. We're going to talk about lubes, condom compatibility, toxins, things you can be using to support your microbiome of your genitals, because we know that the microbiome of the genitals has a huge impact on health of this region, on preventing things like vaginal dryness, on preventing things like infection. And so many people are doing things like putting products on them that are petroleum-based, for example. And we know that some of these other products can lead to problems such as infection. Studies have shown, for example, that we see that some of these toxins we are using can lead to things like bacteria vaginosis, right? Destroying that microbiome and so much more. So I really wanted to bring Heather on today, who is the founder of Desert Harvest, one of my favorite lube companies in the entire world. And I also want to remind you as we're getting started, remember everybody that for exclusive content, you can always join me at the Libido Club. You're going to find information in the show notes today on that, as well as discounts of how to get Desert Harvest products and more. And remember, in the Libido Club, you get the exclusive content. This month, we're really focusing on the topic of toxins because it's so important. So thank you so much for being here today with me, Heather, and I can't wait to get our conversation started.
Thank you for having me. I'm looking forward to it.
So let's just open this conversation around lube in general. And can we kind of start with like different types of lube and why somebody might think about one type of lube versus another type of lube?
There are a variety of different types of lube out there. The most common are going to be your water-based, your petroleum-based, and then your silicone-based. And then you've got kind of a mixture of natural options as well. And the problem with what we have out on the market is that most of it shouldn't go into the vaginal biome. The minute we start introducing particular types of chemical ingredients, we are not only throwing off our pH, but we're throwing off our osmolality. And this is something that is very much under recognized. There's only been one study done that was done by the World Health Organization in 2015. And this was for third country sex workers to figure out how to reduce the incidence of STIs. It wasn't just in general for women in general here. And so as a result, most women don't know that we should be looking at osmolality. And this is how the fluid flows in and out of your vaginal wall, your epithelial cell layer of your vagina. This is your protective barrier to STIs, bacteria, fungus. And if you start introducing ingredients that are not isoosmolar, they're either hypo or hyperosmolar, then what happens is slowly over time, your epithelial cell layer, your vaginal wall begins to dry out and it literally falls out. So you've just lost your barrier of protection. And so it's very important that as we're looking out within lubricants, this separate of pH, which you want your pH to be acidic, you want your biome to be acidic. And if your biome is not acidic and your tissues are unhealthy, it doesn't matter what you put in there at that point. It's going to probably burn and be uncomfortable from micro tears and unhealthy tissues. And again, having that barrier kind of missing. So as a result, it is very, very important that we not only choose an acidic right around 4.5 for pH, but we also choose a lubricant that is also isoosmolar. And again, the World Health Organization is the only one that's kind of set this directive in which ideal vaginal osmolality is 290, and you only want to be plus and minus 80 points on that scale. And as you can imagine, most of the lubricants, when you walk inside a store, there's only two I know of that are truly isoosmolar in the entire world. And then otherwise, you're looking at what you find in the health food stores, in the grocery stores. You're going to find 10,000, 9,000, 8,000 osmolality. Where your biome is 290, remember, plus or minus 80 points, you're destroying your biome with these. But unfortunately, this is something that is not regulated within our society of these products. They're required to do testing. Now, one of the big things that you can find out with lubricants is if they are an FDA controlled, cleared medical device, which is what lubricants are required to be, they will have that osmolality number because it's required as part of the testing to get the government medical device certification. You will, however, find a lot of lubricants out there kind of promoting themselves kind of under the radar. So you'll see things like where you need a little extra slipperiness or gut, but you won't talk about them inserting it into the vagina. You'll just hear them talking about intimacy and having fun and play, and you can utilize this. But that means that they are not an FDA cleared medical device and they are not regulated to go inside your vagina. And even then, it doesn't necessarily mean that they're isoosmolar because that is not a requirement. You're required to have the osmolality testing. You are not required to be isoosmolar.
This is such good information. So from a standpoint of consumer, in differentiating between products, is a company that is kind of like not with the FDA regulation, but still promoting their products kind of in the intimate space, are they allowed to use words like lubricants?
They are not. You might see this. Unfortunately, one, we've completely gutted the FDA, so we're in worse shape than we were even last year. And last year, even then, they couldn't. They were trying to give. So just to understand, they didn't regulate medical lubricants as medical devices until around 2015. So as a result, you've got all of these companies needing to play catch up, and they kind of gave a 5-year window in which they were going to give people time to catch up, get the certifications that were necessary to keep their product on the market. Well, then the pandemic hit, and FDA didn't really have a lot of time to regulate that. And then now we've got a gutted FDA. So they're not regulating the way that they need to be right now with lubricants. I expect that to come in the future. And that will be a thing. But right now, you're going to find a lot of stuff on the market that could say lubricant, could say other thing. It just may not say, hey, put this in your vagina. But yeah.
Yeah. And it's always important to remind everybody, like, what we put on our vagina, what we put on our skin in any sort of way, like, our skin's so porous. And so if it's one of these things where it's like, wow, this is like not safe to be in the body, we don't want it anywhere near us. We don't want it in our vagina. We don't want it on our penis. We don't want it in, on our skin, any of these areas. So, okay. So then in a consumer standpoint, so now we know the FDA component. Now, what about, can you redefine exactly the osmolarity? Because you said that it is required then from the FDA to put the specific number, correct, on the product. So
it is not required to put the number on the product. It is required for them to do the testing. So all of them have their number. So if they're not advertising their number, there's also a good point to question. And there's nothing wrong with reaching out to the company and being like, hey, what's your osmolality number? Because if they are FDA compliant, they know that number.
Okay. And then ideally for the support of the pH of the vagina, can you say that number again, what we're looking for?
So 4.5 for pH, 290 for osmolality, only plus or minus 80 points. And you only want to be plus or minus a couple of points on the pH scale for a lubricant as well. And then just to preface, don't ever use a vaginal lubricant inside your anus. Because the anus is going to be completely different. That is a alkaline biome, and it is sensitive to osmolality, but it is more sensitive to pH in the anal biome. So if you used an acidic lubricant in your anal biome, it instantaneously falls out your epithelial cell layer. So it's even more sensitive in the anal biome to the pH than it is even to the osmolality.
Okay, that's really helpful. So I understand this too. So are you saying that the osmolality can then influence the pH?
No, these are two completely separate mechanisms. So with the pH, this is all about acidity, maintaining the acidity of the biome. The osmolality is about fluid and fluidity, letting the fluid be able. Now, what blocks that is the chemicals. So the chemicals block the fluidity of fluid because essentially you talk about it being porous. Imagine it like a sponge. It's soaking up, it's pushing moisture up to the top when you're getting wet. It's creating that moisture, but it's also moisturizing those tissues all the way down through the layers of the tissue. So as a result, if you can't make that fluid flow back and forth, what happens? It dries out and then it falls out.
So in many ways, we're saying with the osmolality that that's helping with the fluid and kind of in many ways like the natural lubrication, encouraging the natural lubrication of the vaginal tract. And then the pH is really helping the microbiome and all the benefits from the microbiome, correct?
Correct. If your pH is off, that microbiome becomes unhealthy. Instead of breeding healthy bacteria, you start to breed unhealthy bacteria.
Now, are there any other things that you know about? So that kind of helps us with lube. Are there any other things just kind of like health and lifestyle that you've come across in your research that really can influence the pH or the osmolality?
Yeah, so definitely many things affect our vaginal biome, whether it's how we're utilizing soaps when we're washing down there. Obviously, nothing needs to go inside your vagina to wash your vagina. When we're talking about vaginal steaming, douching, things like that, don't ever. Your biome does not need that. It is self-cleaning. But we have been programmed as a society to feel that need to feel clean and fresh. And if you're utilizing, and at most soaps on the market that you're going to buy in the store are going to be alkaline. And so if you're washing your vulva, you can actually influence your vaginal biome as well, and show it alkaline soaps that can influence the behavior of your vaginal biome. Same thing with sperm. If you're having sex with a partner, you're not utilizing a condom. You're influencing your vaginal biome because sperm is alkaline. So again, thinking about how do you reset that acidity when afterwards? How do you reset that acidity after you're having sex with your partner, especially if you're looking to conceive, other things like that? There are different types of spermicides. One of the ones I recommend is a brand called Good Clean Love because it doesn't damage the biome. And then if you're not looking to conceive, the aloe glide, this is where you can insert that just to keep tissues healthy. It's actually, our Desert Harvest Aloe Glide is an FDA cleared medical device as both a sexual lubricant and a vaginal moisturizer. So you can just insert something like that just to keep the tissues healthy, help to reset that pH if you're exposing yourself to alkaline substances. The other case in which you can affect it, obviously, is our underwear, as well as during menstruation, because we're creating a more alkaline environment during menstruation as well. And so how do we influence those behaviors? And that, again, can go into the type of underwear you're using. We've seen all over the news, everything else like that, where we're talking about, PFAS chemicals in our pads and our tampons and other things like that. Desert Harvest is actually getting ready to release. We actually release next week live. We had a little bit of a delay. Lunation. And we created a new fabric made out of aloe. Aloe is naturally antifungal, antimicrobial, antibacterial. And then we created a layer of ginger to deodorize. And then we created a layer of bamboo, which is going to wick moisture. And we have a waterproof organic cotton that will be kind of like a fail-safe layer as a protective barrier. So but then again, we also made them sexy. We created natural like lace so that they're, we don't have to wear granny panties when we're menstruating or urinary leakage or anything else like that. So that's kind of why we created these. And it will show that no chemical has ever touched an inch of fabric in every single batch of that fabric that we make. And so that gives you an idea of what we need to be looking for. If we're just looking for regular underwear, organic cotton is always a good go-to. And looking at how we're influencing our biome from just what we're wearing.
Just a quick break to let you know that 80% of women do not have orgasms from vaginal intercourse alone. So many people are not having the type of sex that is healing, that brings them closer, that brings them more connected, that is full of so much pleasure and passion that it can build bones, reduce stress, help serotonin, bring happiness, lower anxiety, improve sleep, and build a better connection with your partner. That is what hot and modern monogamy is modern monogamy that brings in all of that passion, that desire, that closeness, and that healing. And that's what you can get at the Hot and Modern Monogamy Club. So if you're interested in that and I can help you, please go to modernmonogamyclub.com. Now back to our show. Amazing. And just so everybody knows, the PFAS chemical that Heather has mentioned here, it is getting more notoriety these days. It's really a class of chemicals that are also known as the forever chemicals. And it's because they're called the forever chemicals because these are things that we are creating in society that don't break down in nature. And so other types of chemicals sometimes stay in our environment for many years, but eventually can get broken down. And one of the biggest problems we're finding with the PFAS is that these chemicals don't break down. So they get in our body, they get in our environment, and they don't naturally break down. And they're being linked to more and more and more diseases as we learn more about them. So doing something like a menstruation underwear with the types of technology that Heather's talking about is a really important thing because a lot of people are putting these chemicals in their body. The vagina is porous. They're getting into their bloodstream. They can cause all sorts of problems, including disruption of our hormonal system and keeping them out is so important out of our vagina, out of our skincare products, out of our food, all of the things. I also want to circle back to something you said when you're talking about the health and the pH, and you were saying, okay, don't douche, don't steam. I want to clarify that because yoni steaming, I know, has gotten so it's really been talked a lot about in the female vagina self-love, self-care, movement where you sit on this, oftentimes this device that kind of looks like a toilet seat with something below you that is typically hot water, warm water that oftentimes has a bunch of herbs in them. And the concept of yoni steaming is using different herbs and with the almost like making a tea decoction, the herbs infuse into the water and that steam then goes into the vagina. And so it is promoted so much. I know actually quite a few people who do yoni steams regularly. So are you saying that that can even be dangerous to the microbiome?
Yes, it can. So, in a lot of situations, women are going because they think it's just killing the bad bacteria, but it's also killing the good bacteria that your vagina needs to continue to be self-cleaning and self-functioning and maintain your natural healthy biome. And so by utilizing vaginal steaming, yoni steaming, this can destroy all of that good bacteria. And so we highly do not recommend that. And most of the clinicians we work with don't recommend that just because of the damage that it does to the vaginal microbiome. And none of the evidence suggests that there is enough benefit to make it worth it. Might feel good afterwards, ladies. You might feel wonderful, but it's definitely something that, at least in the medical community, is something that's talked about as not being recommended.
Okay. I think that's really important for people to hear. What about, I want to circle back around to kind of the toxin standpoint. So we know, as I mentioned at the beginning, as you mentioned in your intro, petroleum's such a common thing in a lot of these different lubricants. What is that doing? Is the problem that you see also in a similar construct around impacting the pH and osmolality? Are there other things you've seen that are problematic with it?
Yeah, so definitely with especially with the petroleum-based, those that are introducing other types of preservatives, glycerin, other types of glycerin, things like that, that are acting as chemical preservatives. What those are doing is, one, glycerins are going to create and breed bacteria. They're sugars, so they're going to create bacteria. They're going to help grow yeast, and this is, of course, something we don't want in our biome. And then with regards to the petroleum, one, we're again creating a barrier between the fluidity. But you think of petroleum, think about when you put Vaseline on, something like that. It's acting as a barrier. It's not letting your fluid flow within your vaginal wall. And so this is one of the biggest problems. Now, interestingly enough, silicone is actually has no osmolality. And so because it does not have, so like silicone based, but then we go into the question of we're dealing with a chemical again. So we're still introducing a chemical to our biome. It doesn't affect the osmolality, and it doesn't affect necessarily the pH. It's kind of just very, amorphous. So it's not going to have that kind of effect with the silicone. And so it becomes a multi-use tool in that it can go back and forth, but we don't know the ultimate effects of the chemical nature of silicone, and how that, and similarly, if we want to skip over to, let's say, coconut oil. This is a big one. Everybody's like, oh, I'm using natural. It's great. It's wonderful. And yes, again, very much like silicone is going to be androgynous. It's not going to have that osmolality factor. But unfortunately, what we have seen in clinical research is that the coconut lube that people are using, this coconut oil, they're seeing, one, it's messy and nasty, and then two, we're seeing that over time it begins to breed back bad bacteria. And so even though we think that this is, going to be completely androgynous, it is not like silicone in this sense, because the pH will ultimately in the long term affect when it comes to coconut oil, whereas we see with silicone that doesn't happen.
Yeah, and I've researched and reached out to quite a few people about not using coconut oil, also from a standpoint of we do see evidence that it is antimicrobial, right? So, what you're seeing in studies around breeding bad bacteria, in my mind, is probably coming from the utility of using it. And since it's antibacterial, we can be killing off our good microbiome, which then naturally sets up a environment where these pathogenic bacteria can make their home there, because our microbiome is part of what is protecting against that. So I think that's some of the mechanism that's happening there.
Yeah.
I want to talk about the use of aloe in particular, because it is something that I think is particularly important with your product. And there's research that I'll ask you about here. I know it's helpful for things like interstitial cystitis, and for our listeners, interstitial cystitis, I feel, at least in my medical practice, is, I think, a very underdiagnosed condition. I look at what this is as kind of like a leaky gut of the bladder. So it's really where people are having this signal this signal of urgency that can almost feel like a bladder infection, except it typically is not going to like burn when you pee. And it's more this urgency, because what's supposed to happen in the bladder is when we get that signal to our brain to urinate, that's coming from the bladder expanding far enough. And when the bladder expands, it triggers our nervous system to say, oh, the bladder's expanded, it's full. The nerve sends a signal to the brain to say, hey, your bladder's full, you got to pee. And with interstitial cystitis, one of the things that will happen is that signal gets disrupted due to bladder irritation. And so this signal, when the bladder has maybe only expanded a tiny little bit, you're getting that signal, that urgency. I got to go. Maybe you go. And it's like, wow, there's not much there. And this intense feeling, which sometimes can be interpreted even as pain, can radiate. And it can actually radiate to the genitals, to the vulva, to the vagina, and lead to people seeking out medical attention, not even realizing that it's ultimately coming from their bladder, but it's being interpreted as pelvic or vaginal pain. And I think it's oftentimes misdiagnosed because people don't know how to describe this. So they get tested for a UTI, which is negative. And then they're just like, okay, well, it's just in your head. You're fine. Go out into the world. So if you're having any sort of symptoms like that or pelvic pain, this can be a helpful, tool. So tell us a little bit about that, around like the choice of aloe, around some of the research there with cystitis, pelvic pain, and those kind of things.
Yeah, so that is actually how Desert Harvest started in 1983. My aunt had the bladder disorder, interstitial cystitis, and we were looking for something that might be able to help her. And we stumbled across aloe vera. She took a random bottle. She slept through the entire night. And then we wanted to figure out how we could concentrate it, how we could make it safe for long-term use and in high doses. Aloe vera naturally has what's called anthraquinones in them. They're latex chemicals that long-term can be carcinogenic to the colon, cause liver damage, kidney damage. So what Desert Harvest makes is not what you find in the health food stores. This isn't your juices. This isn't juices will actually irritate the bladder, because there's only two ways to preserve aloe vera juice. And that is through bladder irritating preservatives like citric acid, lemon, and other things like that. And then two, pasteurization, and which is really just expensive water at that point, because you've just killed all of the nutrients. And aloe vera is 98%, 98.9% water. And so literally you are drinking expensive water. And so we're actually studying right now for FDA drug trials at Wake Forest University, our super strength, our SSAV. And what we're studying is how it interacts with the urothelial cell of the bladder. So, you talk about high rate of misdiagnosis, and it is misdiagnosed within the field, and then it's misdiagnosed in a lot of cases in which women are seeking, mostly women. There are also men. There's about 25% men, 75% women on average. And it feels like a constant UTI that is not going away. And as you mentioned, most people end up with negative UTI results when they go in for a test in their doctor's office. And so as a result, what is happening is it's affecting the urothelial cell lining of the bladder. In most cases, most actual true interstitial cystitis patients have true bladder wall impact. So they either have lesions or they have a very large inflamed bladder. That urothelial cell layer is damaged and or completely missing. And then as a result, you imagine you eat something that's acidic or something like that, and it passes through that bladder. It's like, battery acid on a wound. So that's where you get the pain. That's where you get the burning sensation when you start to urinate, and you start to deal with capacity issues where you feel that urgency feeling. And in some cases, over time, as a result of the lack of health of the bladder can shrink to a very, very, very small size. And that's why in clinic, a lot of the times doctors will stretch your bladder. Not the most comfortable procedure in the world, but this is what will happen. It's called hydrodistension, to try to get your bladder back to capacity. But at the same time, there is no known etiology. What causes interstitial cystitis? We have no idea for treatments exactly right now. That's why Desert Harvest, we have an 87.5% response rate with actual interstitial cystitis patients. But what has caused the problem is the waters have been kind of muddied by the fact that we started in the early 2000s making it a diagnosis of exclusion. In the rest of the world, you have to have a cystoscopy, again, highly uncomfortable, and usually leaves you with some radiating pain for a few days. And as a result, doctors didn't want to continue to subject patients to continual pain. So as a result, we started making it a diagnosis of exclusion. You don't have this, you don't have that, you must have this. And so as a result, it's kind of muddied the waters for interstitial cystitis and muddied the waters for research. The great news is just a couple of years ago, Dr. Lenora Ackerman at UCLA, she actually did a study on utilizing AI and machine learning. And it was the first time that we had ever been able to truly, there'd always been theories of what phenotyping out, subtyping out interstitial cystitis into different conditions, so that then we could get to the root cause of interstitial cystitis. But unfortunately, clinical research has never been able to do that. So she did a study where she actually put in 600 or so respondents into filling out these questionnaires. And they were, through machine learning, were actually able to find 3 distinct categories. And that was bladder centric. All their pain was coming directly from their bladder. And then you had kind of a myofascial pain, 88% resolved with pelvic floor physical therapy in that group. And then the third group was like a neuralgia, non-specific type of pain. You were radiating pain from somewhere else in your body, another condition, another injury, things like that. And it wasn't truly the impact of your bladder, but it was causing that feeling of pressure and urgency through the neuralgia. And so this is going to change things for interstitial cystitis, hopefully, and get us to the root cause, and so that we don't have such a high rate of misdiagnosis, and we can truly determine, because most women who have pelvic conditions need pelvic floor physical therapy. When you think of a condition where you're in pain, think of when you get into a car accident, everything tenses up and you need to go get massage or chiropractor or whatever. Think of that as the same thing with your pelvic floor. When you're experiencing a chronic pain condition, you're not feeling well, your pelvic floor is your hammock to everything in your body. It's your root. And as a result, it takes on the impact of what you're feeling and almost becomes like a dish rag that's super, super tight. And you need to be able to release that pelvic floor. And many people go to Kegels and they're like, let me do my Kegels and stuff. And that's the worst thing you could do. You've got to be able to release your pelvic floor. And that's seeing a great pelvic floor physical therapist before you strengthen it back up and learn the exercises to strengthen up and figure out which part of your pelvic floor is in a weakened state.
Beautiful. And I want to add to that in my clinical experience, while it is a confusing thing, right? And the etiology of this is not fully clear, and diagnostics are not even fully clear, as you mentioned, because of diagnosis of exclusion. I have seen many cases in my clinical career of like what seems like interstitial cystitis, or somebody has been diagnosed by a previous doctor with that, where getting toxins out and getting food allergies out actually make it go away. So one of the things that I think is great about holistic medicine and what I've seen clinically with this is so many times when we're actually cleaning up the diet, we're getting out the toxins, we're getting out any chronic hidden infections, which is crazy common, not just pelvic chronic hidden infections, but systemic. And these things that actually create that stress, that inflammatory response on the bladder and the nervous system, things just start going away. So that's another thing I want to add to here from an etiology standpoint. Not saying that there's tons of research behind it, but clinical evidence in some of these scenarios is a huge component of what we have to go on. So I just want to add that for our listeners here as well. And this has been awesome. I love everything that we have covered today. I think this conversation on osmolality is really important and helpful. This conversation on pH, helping people understand that not all lube is the same, and that using an aloe-based type of product can not only provide support with this, but also can help with healing, and that not all aloe-based products are the same either. So I think being responsible consumers is just such an incredibly important thing. So is there anything else in our time together? And again, everybody, I'm going to have links for Desert Harvest and some discounts for you guys in the show notes on this. Definitely look at joining my Libido Club, where we will go more into toxins, hormones, techniques, root causes, on and on and on and on to support you, your libido, your love life, your desire, your passion, and more. And all that being said, Heather, are there any final points? Is there any final points that you want to make sure we say today?
Yeah, pretty much. I'd say just claim your pleasure and realize that even if you have a chronic pain condition, there are ways in which you can claim your pleasure and mediate that with the health of your body at the same time. You talk about interstitial cystitis and the overall health of your body. When we say mind gut health approach, it's 100%. In a lot of cases with interstitial cystitis, there's a mast cell activation component. They call it the allergic bladder. And a lot of the times taking antihistamines or over the counters like quercetin, things like that, can make a massive difference for just the health of the bladder outside of interstitial cystitis. And so definitely following your path and your journey towards recovering your health and your pleasure is part of the reason why Desert Harvest is here, the part of the reason why Dr. Mueller's here. And we would love to be a part of your journey in any way possible. So.
Amazing. Well, thank you again for being here. Thank you all for listening. And we will see you real soon on another episode of the Libido Lounge. Take care.
Bye.
Awesome. Thank you for listening to the Libido Lounge. Please don't keep me a secret. Please share this with your friends. You can find me on YouTube, on Instagram, as well as how to work with me at mylibidodoc.com.